This video is for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Please always seek advice of your physician or other healthcare provider with any questions that you may have regarding any medical condition. Hello everyone, welcome to my channel. Today we are going to discuss a complex and often misunderstood mental health condition known as factitious disorder, also referred to as Munchausen syndrome. We'll cover its definition, core deficits, epidemiology, pathogenesis, evaluation, and both non-pharmacological and pharmacological treatment. Let's dive in. Factitious disorder is a mental health condition where an individual deliberately produces, feigns, or exaggerates symptoms of illness in themselves. This behavior is driven by a desire to assume the sick role and receive medical attention rather than external incentives such as financial gain. The core deficits of factitious disorder include deceptive behavior, which is a person deliberately falsifying symptoms to induce injury; psychological need, a strong need to be felt or seen as ill or needing care; and an absence of external reward, which is not motivated for financial gain or not motivated to avoid legal responsibility too. Factitious disorder is relatively rare, with prevalence rates difficult to determine due to the deceptive nature of the condition. It's commonly diagnosed in women and healthcare workers, but also with males and others. It is evident that there is genetic predisposition to it, but non-genetic factors such as trauma, abuse, neglect, and a background in healthcare system can also contribute to the development of this disorder. To diagnose this and evaluate it, we need detailed interviews to understand the patient's medical history and behavior. We have to review those medical records and identify patterns of frequent hospital visits and inconsistent medical histories. And very importantly, to use psychological tests to assess underlying medical health conditions. The non-pharmacological treatments include CBT, to address psychological issues and also to develop healthier coping mechanisms. Family therapy is extremely important to improve communication and emotional support. And lastly, behavioral interventions are extremely crucial as well to reduce hospital visits and medical interventions. As for the pharmacological approaches, antidepressants can be used to manage depression that could be co-occurring with personal need to require more affection and medical care. Anxiolytics can also be used to reduce anxiety. Overall, factitious disorder is a challenging condition that requires a comprehensive and, very importantly, a compassionate approach to treatment. If you or someone you know may be struggling with this disorder, it is important to seek professional